Up next on Talking Points with Preferred Health Magazine, we are speaking about breast implant illness with iHeartRadio host and media maven Xen Sams. So I want to start in the beginning. When did you decide implants were something that you were interested in getting? How old were you? What type did you get?
So I got my implants when I was in my early 20s. I had just recently battled thyroid cancer and I was diagnosed with Graves' disease. I underwent radioactive iodine treatment and lost a lot of weight as a result of the radiation, including my eyelashes and my eyebrows. But the weight was what really shook me because it was at the height of my modeling career. I was signed to Elite New York under Monique Pillard, and I was shooting a lot of the swimwear campaigns, and I was shooting a lot of lingerie because I'm 5'7", right? So I wasn't doing high fashion, but I was doing a lot of catalog work. The weight, I lost my boobs and I didn't feel good about myself, and I really didn't want to go back to work. I didn't want to model at all anymore. And in fact, I took a year off, met my husband, got conservatory trained as an actor at Lee Strasberg and Stella Adler acting studio. And then when I started dating my husband, he said, you should be so happy about, like, you survived this, your body looks great, you should go back to modeling. And I did. And I started getting requested, except I was no longer the chest size I was. So I decided, you know what, I'll go get implants, just small ones. So I got 250 cc's, saline implant, really small. Didn't do any major reconstruction. It was just straight up under the muscle. Had it done in Canada by a doctor called Dr. Moufarege, and then came back here and had absolutely no issues and no symptoms for 14 years. I kept the saline implants. Everything was fine until I noticed one starting to lower, and happened last August. And at the time when one started lowering, I, interestingly enough, Angie, had a segment on my show called The Rankin Difference, and it was all about breast implant illness. And we covered all the voices in the BII community who had implants and who were told by the medical community that there are concerns and that their symptoms were not valid. It was hogwash. It was in their head. It was just symptomatic of something else, right? So all of these women were hushed under the rug, and not even their concerns no longer addressed. So we started this podcast, this segment within my live radio show, within my live radio and TV show, and we started really bringing on the voices that were not heard. And we started for the last 3.5 years, we had everyone on, from celebrities to models to doctors to experts, attesting that breast implant illness is in fact a real thing. Now, the irony is that I would come on the segments and I would say, by the way, I have saline implants for 14 years and I don't have an issue, but I want to be your voice, and I do want to bring your concerns to the airwaves because I do have a big medical community that listens to my show. Fast forward to, I call Dr. Rankin and I say, I think I have a rupture. And he says, okay, well, listen, you can come to Jupiter, Florida, and I could take care of it. And this was in June of last year. And so I decide, in June, in August, we decide, okay, I'm going to go for it. And in December, I book to have my breast implants removed. And I make the decision to not implant and just get a natural lift, because I had heard all of the horror stories about breast implant illness. And at that point, the FDA in October of 2021 issued a black box warning stating that all implants, whether it's saline, silicone, any shape, any form, right, can cause cancer. And there's certain types of cancers on the rise, and it's implant at your own risk. And it's up to the surgeons to give the women this disclosure, which unfortunately, more often than not, they skim over this, telling the women these are perfectly safe, when in fact, we know they're not, right? They're no longer perfectly safe. The studies are coming out, and we have clinical research, clinical data verified that this is something that could be dangerous to certain women. Now, there's certain women that have implants and have absolutely no reactions, or have or don't know that there's symptoms happening to them as a result of the implants they have, right?
That's right,
So
because there are so many, there's about 100 symptoms they're saying that can be associated with it, anywhere from headaches to gastrointestinal problems. So it's hard to decipher, and I'm sure a lot of women are being misdiagnosed for this. So when you got your implants removed, did you then get more implants, or what were your symptoms of the sickness? And you had BII, correct?
correct. So what happened was the months leading up to my explant surgery, I did not know this, but I had high blood pressure in the morning, and I did not know why. I would wake up with a really high diastolic number. The lower number was high, and that made no sense to me because I'm active. I don't have, I don't smoke. I don't drink. I don't have any, any medical complexities for me to have high blood pressure, especially at my age. So I didn't understand why. And then by noon, everything would drop to normal, to a very normal blood pressure, 110 over 65, right? But I would wake up with 130 over 100.
Wow.
So it was nuts. So I didn't know why. This went on and kept going on. So I did 150 primary tests, 66 secondary tests, 4 MRIs with and without contrast. You're fine, go home. It's your work, it's stress, could be premenopause. I got a million different answers, but nobody could tell me why. So I started going on this Ayurvedic by a company named Ivy called Muktavati, somewhat lowered it. That was prescribed to me by Dr. Nate Leibowitz, a friend cardiologist here in New Jersey, and that somewhat worked, but still did not nip it in the bud. Well, I explant December 18th. I go all the way to Jupiter, Florida. Dr. Rankin takes the implants out, and upon taking out the implants, he noticed that one of them had a valve that was leaking. The saline had been leaking out of the valve slowly, hence why I thought it was a rupture, but it wasn't. But inside the valve, there was mold. So what we realized is that I was being slowly poisoned by mold toxicity, because as the saline was seeping out through that valve, it was taking the mold with it. And when I would sleep at night and I wasn't able to sweat it off, if you will, because during the day, your body is it's always sweating, right? Your body is constantly secreting for whatever reason, right? And you're getting rid of the toxicities through your sweat, through urine, through through exercise. But when you're sleeping at night, your body is just in docile mode, and it's really not doing much except laying there. And so the mold was seeping into my bloodstream. It was causing me to sweat it out at night. I had major sweats. I would wake up and the sheets were soaked, and I thought it was, again, premenopause. And so that symptom of sweating at night and increased blood pressure in the morning, when I took out the implants, I was fine for that week. No high blood pressure, symptoms went away, migraines went away. So I did not know at the time, but I had always suffered from migraines for the last, I want to say 15 years. Really, 2 years after I got my implants, I started migraines. And then continued to suffer to the point where I would get migraine Botox shots on my forehead line by Dr. Draft at NYU to treat these migraines. Well, since December of 2023, I've explanted now my breast implants, and I got a natural lift. I did a total capsulectomy. He got rid of everything that was in there that could have possibly been, toxic. Yeah, the cause and the really, you have to get rid of the capsule. The capsulectomy is extremely important because that's where the tissue, and that's where all the cancerous or precancerous growths could happen as a result of whatever's leaching out of those implants, whether it's saline or silicone. We know for a fact both of them can cause cancer, and infections. So for me, it was a heaviness on my chest. It was night sweats at night. And it was extreme blood pressure, high blood pressure in the morning. All symptoms went away within 1 week of explanting. The migraines didn't go away right away, but now 6 months later, I have no migraine. I don't suffer from migraines anymore. I sleep well at night. And I just, it was a rude awakening for me, because here I am promoting breast implant illness and saying I don't suffer from it. And the whole entire time I had in fact been suffering from breast implant illness. And now that I know, my mission is to educate as many women as possible and really just let women know it's okay to implant, but implant at your own risk. And once you implant, you're a patient for life. You're never going to want to take them out and go back to being a smaller size unless you're suffering in some capacity, because no woman implants goes through all of that to then explant. You're explanting because you're out of options. There's no other choice.
That's right. And you're not the only one. I've spoken to a few other women myself who have, once they've gotten it removed, all symptoms went away. And so I just want to know, like, when that happened to you and you're telling your doctor, hey, I don't have any of those symptoms anymore that I've been dealing with my whole life, what was his reaction to that? Did they still kind of say, oh, well, it was because of something else other than BII?
Believe it or not, Angie, every single doctor I have said, wow, we are believers now. And I documented the whole thing with photos, the entire surgery, my drains. And then I went one step further. I sent out the implants to a lab and got a toxicology report. The mold growing inside that one valve that was faulty was the type of mold you find in washing machines. It was really shocking to me that the FDA doesn't necessarily have to guarantee the valve, just the outer shell, if you will. So you don't know where these valves are coming from, where they're manufactured. Women are putting implants into their bodies to help them look and feel better, and it's slowly poisoning us. And really, it's at the expense of us wanting to fit into a societal standard of this beautiful body that has been projected by men, and most plastic surgeons are men, right? So if you start to look at the female doctors, they're really taking this holistic approach of natural fat grafting, using a mesh perhaps, but implants, it's almost a thing of the past. They're not even sexy anymore. Most women want to just be au naturel.
More natural. I see that happening also. I mean, even though there's millions and millions of women worldwide, probably over 2 million, I believe the statistic was, that have implants. I mean, it's still on the rise. Obviously, people still want to conform to this, Barbie body. With some going backwards for a ballet look. Also, I've been hearing about this ballet body now, so maybe a little bit smaller, but still, I mean, natural is best.
Natural is best, yes.
Natural is best, even if it's using your own fat, if for some volume, but implants are definitely cancer causing. And if anything else, BII is a symptom of having implants, and millions of women are suffering from that. I wanted to ask you, at what point, like, how long did it take you to say, all right, enough is enough? Besides thinking that, it had a capsulized, did you feel that you had to just get into the doctor and get them removed? What did you think time frame? Was it quick? Was it just kind of like, I woke up one morning, I had those?
Well, so the rupture, it slowly started lowering in June of 2023. By August, it was much lower, and I knew that there was either a leak or a rupture. I wasn't sure. And then that December, I had them removed. So it was, over the course of four months. And when I knew, and I knew immediately that I didn't want to have implants put back in. I did not want anything in my body because, number one, I have a daughter and a husband, and I don't want to have to keep going under the knife electively for absolutely no reason. Like, why? You're going to need a revision surgery in 10, 15 years. And they're saying, oh, some of them could last 20. Yeah, good luck. You want to keep these in for 20 years? Let me know how that works out for you, because at some point you must question what's going on within that capsule, what's going on within that implant, what's going on around the breast, and what about the lack of imagery? You can't get a proper mammogram if you have breast implants. You just can't. You will rupture them, and then you're going to have other complications. So now they're saying, well, you should opt for an MRI. And now it's the insurance companies that now have to pay for the MRI once at least every 10 years for women that have breast implants. But even at that rate, you know, you're still not following protocol at the expense of having a beautiful body and volume, right? Or so whatever body that you want to deem beautiful that led you to get those implants.
That's right.
So I just want to tell women, just feel it's not worth it. It's not worth the health risks. It's not worth the complications. A woman just came to me yesterday and she says, and she's statuesque and she's beautiful and she's got a gorgeous body and she has implants. And without implants, she's completely flat chested, or she's very, very, very small. And she's a model. She's a friend of mine. And she says, I have an ongoing active infection because of my breasts, and I still don't want to take them out. So she's on antibiotics, like prophylactically, to combat the active infection that her implants are causing her. So she's researching how to get them removed. And then she still wants to reimplant. And then she's saying to me, and this is the rationale I don't understand women. She's saying, not only, yes, I want to do it all in one step. I want to get the implants removed. I want them to clean the infection, and then I want them to reimplant at the same time so I don't lose the structure. And I'm listening to her and I'm like, first of all you should be thinking about is getting them removed, getting that capsule out, letting your body heal, and then deciding what to do, not all in one shot. But when I hear these stories, I'm thinking a lot.
It takes a long time, and it's going to take, especially in her field. I can see why that might be something important to her, but people eventually need to understand that your health is more important than anything else. I mean, and I think that's hard for a lot of women because of our careers or whatever, or what we deem as womanly, usually pertaining to our breasts. But it's going to take a while. I'm sorry that your friend doesn't see that just yet. I don't think people see it as something important. I think when you have family and friends and your child's looking at you, you want to set that example for her health and for how she, looks at the way she lives her life and takes care of herself growing up. So I'm glad that you did it, because I love that you're around.
Yes.
It's dangerous and it's scary. What would you say to just women in general who are having symptoms like your friend there? What should they do? What should be some of the steps they should take?
The first thing, is be realistic with yourself and look at what symptoms are currently affecting you in your life that may or may not even be related in your mind to your breasts. List every ailment you have. I mean, I had a friend of mine, she said, I wake up sluggish. I'm all constantly feeling like I'm fighting inflammation. I have migraines, brain fog, pain in my back and my joints. She's just not feeling well. So I asked her to evaluate. Could it be your breast implants? Could it be, when did your symptoms start? So number one, look at your body within. Look at what it's talking to you. It's always, your body is always talking to you. Number two, be realistic. Implants cost money. They're maintenance. They're also a sacrifice. They also may not end up looking the way you want them to look. They may be off to the side. They may shift. You don't know how your wall cavity is and how it sits. So you're never going to get that perfect look, no matter even if the doctor tells you to, that you would, right? And more importantly, start evaluating that this is not the first time you're going to go under. Once you start, you open up Pandora's box. You must prepare yourself for 2 or 3 more revision surgeries, especially if you're going to get implants in your 20s. By the time you're 40, you need another surgery. By the time you're 60, you need another surgery. So 3 surgeries in, elective, going under, there could be complications, there could be infections, and more importantly, your breasts could be the very reason why you're not feeling well. So I urge women to really just evaluate properly before they, start implanting.
I agree wholeheartedly with that. I don't think people realize the journey that they have to take once they decide to have implants. And I know you're saying maybe 20 years, but I heard sometimes it can be even sooner, maybe every 10 years, maybe every 15 years for revision. So
yeah. And listen, Angie, when you look at this, you speak to doctors all the time. BII, it's a condition that isn't well understood, but it can be debilitating. And I can vouch for that. And when you think about BII, it refers to a wide range of these inexplicable symptoms that can't be explained by the medical community that develop in women who have had reconstruction or even cosmetic enlargement with these implants. And it's because it's not an official medical diagnosis, it's
Correct.
still not well understood. And experts believe that symptoms, and now they're looking at, where the symptoms are coming from. They're caused by essentially an autoimmune or an inflammatory reaction to the very implants, right?
That's
So
correct. That's correct.
and the symptoms really do vary. I mean, I've heard different stories from person to person, but they all include fatigue. They all include joint pain,
That's right.
memory, concentration problems. And this is not something that they're just making up. This is truly affecting their day to day. And women are going into their internists and complaining with these symptoms. So yeah,
Right. And unfortunately, like you said, it's all just underdiagnosed, and there's not a formal diagnosis for BII. There is a low percentage rate, still uncommon, but probably more so because those symptoms are so generalized. I mean, you have a memory loss, like they did to you, they'll associate that with stress. They can associate that with other things. So it's
exactly.
about narrowing down those women who have implants who are suffering from those symptoms and looking further and just diving deep into their health. And their doctors need to be educated on that. It's not for a plastic surgeon to determine. A primary doctor needs to say, okay, you're suffering from joint pain, fatigue, memory loss. These are the symptoms associated with implants. Do you have implants? Like, if they know their patient well. So I agree with you wholeheartedly. And again, thank you for coming on and speaking with me today about your journey with that. And I think that's going to help a lot of other women who are dealing with these symptoms.
Yeah. And it's important to note, I have to say this to women listening, that BII is not the same as the rare types of cancer that can develop in the scar tissue and fluid surrounding a breast implant, right? It's different, but it's important to note that that is where it all leads. And the cancers are complicated. The breast implant associated anaplastic large cell lymphoma, right? BII, which we call ALCL, and other forms of lymphoma and breast implant associated squamous cell carcinoma, so BII SCC.
Yes.
It's worthy to point out that breast implant illness aggravates cells that are predisposed to cancer. So women, please think twice, especially if you have breast cancer in your family history.
Absolutely. And thank you so much for being so informative on this. And I know you've lived through it, so it's just important to share stories from people like yourself.
Thank you so much for having me and giving me the opportunity to speak to your incredible audience. I know you have a big medical following, and I think it's important that all doctors educate women and are open and receptive when women come with a laundry list of complaints, because more than 375,000 women receive breast implants. That was for 2021. I can't imagine. It's probably the statistic is even higher now, and that's like a 45% increase from the year before. So every year, more and more women are getting breast implants, and it's the most common and popular plastic surgery procedure performed in the US, right? And they say it has a low risk of complications, but it most certainly does not. So I just, please, medical community, educate yourselves and the women that you're consulting.
Thank you so much, hon. Thank you for coming on. And I can't wait to share your story for the cover of Preferred Health magazine and see you at our cover party. I can't wait.
So excited. Thank you for having me. I really appreciate this.
Thank you.